So hello everyone, also from my side. Welcome to the HearMus seminar. So this is a seminar revolving around topics such as music and hearing impairment, music and hearing aids, music and hearing protection. And what we like to do is to establish something like a community around those topics to all explore the scientific basis of things that allow us to sustain and enhance access to music for people with diverse hearing needs. And obviously, there's a need for research to address these topics. As probably many of you know, the WHO projects that hearing loss will double from now to 2050. And at the same time, many of us are aware that there's still something like a lack of the knowledge on how to deal with music and hearing devices. And obviously, also music often comes with high sound pressure levels, so often even requiring hearing protection. And all these circumstances make this a very rich topic that has been certainly underexplored in the last couple of years and decades. And yeah, as I said in this seminar, we wish to explore these topics and hope to establish something like a regular exchange and community around these topics. So the seminar is organized by Professor Alinka Greasley and myself. My name is Siedenburg. And if you have the feeling that you've got something to say on this issue, feel free to send us a message and we try to accommodate you in one of the next sessions. So we'll try to have a monthly schedule, which hopefully fits everybody's plans. Our next meeting, just to already start with some advert, will be in November, on November 26th, featuring Sam Kuth and also work from my group. And if you wish to stay informed about these seminars, just check out the hearing aids the musicandhearingaids.com website, which is hosted by Alinka and which also contains information about our seminar here. If you like to use captions, then just go to your Zoom settings and press Show Captions. And I think this is it from my introductory point of view. Are there any immediate questions or comments? So if it's not the case, then I guess we're now a bit too many for all of us to have a say now, but we can probably get to know each other better during the discussion and also after the discussion, which will be on the scientific parts of this. So let me start introducing Alinka Greasley, who will present her work, some of her work today. Professor Alinka Greasley is part of the music department at the University of Leeds and is professor of music psychology there. She's interested in music preferences, music listening, and music and deafness, and musicians' health and well-being, as well as electronic dance music. She draws her musical credibility from her own practice as a DJ and as a violinist, and she has other crazy hobbies that I won't talk about. But she has, apart from that, she has also been really pivotal in getting this field started, especially with her project Hearing Aids for Music that started a while ago and hosted a fantastic workshop on this topic that I was also lucky being able to attend. And this was really a very inspiring event where you could really feel that this is a topic that people should be working on more. She also is currently running part of the organizing team of the Cadenza Challenge, which is a challenge to foster machine learning approaches to optimizing music for hearing aids. And she's also part of the Oral Diversity Network, which is also a very interesting network on the issue of oral diversity. Okay, and this is it for an introduction. Alinka, We're really curious to see what you've got to say, and the floor is yours.
All right, thank you very much for that introduction, Kai. So yeah, I'm aware that some people on this call will have heard me talk about the Hearing Aids for Music project before, and some won't. So give some sort of background to it as well, and a bit of an overview. I just move my slide on there. Is that working? Yep. Okay. So hopefully, yeah. So a bit of an overview of the project and some of the key findings. And then talk about some linked projects that I've been engaged in since. So just to start off with, I mean, Kai has just quoted a statistic here about the prevalence of hearing loss. We know it's increasing and at an extraordinary rate. We know that if untreated, hearing loss can have very many negative consequences, such as difficulty communicating with others, withdrawal from activities, loneliness and depression. Now, hearing aids are the primary technology to treat hearing loss, and they facilitate verbal communication. They improve people's quality of life and improve their ability to engage in social interaction and activities. But we also know that adoption rates do remain low globally. Now, there's lots of different reasons for this. It could be, you know, a fundamental lack of access to healthcare. It can be their perceived effectiveness in noisy situations, sound quality issues, comfort or fit, and also stigma. So lots of different reasons why people choose not to get hearing aids. But one of those may also be the mixed effectiveness of hearing aids for music listening and performance. Now, we know that hearing aids are designed for speech and not for music. So music has a much wider dynamic range and frequency range. And as we're going to hear Christoph talking about in the second talk in this seminar, music is not homogeneous, whereas speech consists of a restricted set of phonemes produced by vocal tracts that are sort of highly stereotyped. Music is produced by instruments with diverse properties. Now, manufacturers have offered solutions in the form of music programs or settings within the hearing aids, but there's evidence that the use of these music programs or the impact of these music programs is mixed. And I'm really pleased to say that there's an increasing sort of literature highlighting the key issues here. When we started the Hearing Aids for Music project back in 2015, it was, there hadn't been an awful lot published in this area, but over the last 5 years, there's an increasing amount, and this is starting to show what the key difficulties are. So back in 2015, we started the Hearing Aids for Music project, and it had 4 main aims: to explore how listening experiences were affected by different levels of deafness, to provide evidence of the issues that were currently affecting hearing aid users with music, so that we could think about advice that could be given or technical improvements, to identify potential ways in which listeners can optimize their use of hearing aids for perceiving music, and also to give hearing aid users voice. Hearing aid users with all types of types and degrees of hearing loss. And today I'm going to be actually drawing on a lot of qualitative quotations, and really that speaks to the aim to give people voice within the research project. Now, this is the Hearing Aids for Music team. I just want to say a huge thank you. This was very much a collaborative endeavour. I was very fortunate to have this interdisciplinary team working alongside me, and they were covering all sorts of different areas: music psychology, clinical audiology, auditory perception, computer science, deaf education, hearing therapy, and yeah, I feel very blessed to have worked with them all. And we had 2 main partners. The first was Sheffield Teaching Hospitals, and the second was Harley Street Hearing down in London. And the project overall was sponsored by the, supported by the Arts and Humanities Council. So I'm very grateful to them as well. So what did we do? Well, we had a series of 5 research studies that we conducted over a period of 6 years. I'll just briefly explain these studies to you. A lot of this work is currently published in various different places. The final publication, the national survey, is nearly there. We're getting towards submission now, which I'm really pleased about, and that would be worth the wait. But yeah, all of these publications are available on the Music and Hearing Aids website, so do go and have a look there. So the first study we did was a clinical survey. This was just a short paper survey that was conducted in the clinical waiting rooms, and it just asked hearing aid users to report on any problems they experienced and whether that impacted on their quality of life, any discussions they'd had with audiologists, and whether that had improved their music listening. And that took place in the NHS Trust, the Sheffield NHS Trust, and then also Harley Street. Our second study was an audiology survey with audiologists. So we'd asked the patients about their views on music listening. So then we wanted to ask the audiologists. So we asked them about the frequency and type of discussions they're having about music listening in clinic, any training on music that they've received, and then also any strategies that they had for optimizing hearing aids for music. And we're very grateful to various audiology societies and independent practitioners for circulating the survey. We've just got some examples down there, BAA, Boots, and so on. The third study was an interview study with hearing aid users. So this was more of an in-depth look at specific histories, musical training, and issues with music listening. And we had some musicians in that sample as well. And then our fourth study was a national survey. So this was a large-scale online survey, and you can see the topic areas that we covered in that survey there. There's various different sections on their musical engagement and training, their hearing background, and their experiences in recorded and live music contexts. We had over 1,500 hearing aid users respond to this survey. And one of the reasons for the large numbers that was because we had some help from the NIHR to recruit in lots of different NHS trusts, and we're very grateful. In fact, we ended up with a sort of almost an A to Z of different NHS trusts participating across the country. As well as those areas that we were looking at in a quantitative way that are listed there, we also asked some open-ended questions about people's musical background and hearing loss history and their experiences of listening to music with hearing aids in both recorded and live contexts. And this has resulted in an absolutely enormous thematic analysis of many thousands of written responses from the participants. And I'm hugely grateful to my colleague, Amy Beeston, for setting about the thematic analysis in such a rigorous and thorough manner. In the last few months, I've returned to the analysis and done some further coding, and it's now complete, and it's going to be part of the supplementary materials of our next paper. Now I'm going to draw, because this is the sort of largest corpus of sort of evidence that we have relating to hearing aids. I'm going to draw on this in this thematic analysis in this talk. The fifth study we did was an evaluation study. We created some resources as part of the project, and then we discussed those resources with patients and also audiologists. We asked them to go away, to read them, to use them, and then we followed up with them to get their feedback on them. So those were the 5 studies, very briefly. So what did we find? Well, first of all, just want to emphasise that we had an overwhelming response from the public, and even to this day in the future projects that we're doing, we've had lots of people signing up to take part. This is because music is really important to people and they want to make a difference. We found in the national survey that 87% agreed that music was important and 2/3 were listening to music as often as possible. So there's a real passion for music that goes beyond just they like music, so they want to take part. They want to really make a difference here as well. And some of them talked about the negative impact of losing music for them. And we can see I've just included a quote down in the bottom corner here, just about the sort of emotional impact sometimes that participating in this research had for the hearing aid users. So I think, an implication of this is that it's really important for audiologists to be asking about music in clinic. We, in the first audiology survey, in the first clinical survey we did, so that very first study, 58% of the patients said that they'd never had a discussion with music, about music with their audiologist. And in the national survey, around 42% had not had a discussion. So around about half of hearing aid users reporting that they hadn't had a discussion despite music being important to them. So I think it's really vital that it's on the agenda for audiologists, but also really emphasises why this should be a key concern for hearing aid manufacturers as well. Now, some positives. Hearing aids are helpful for music. So we asked participants to tell us how helpful hearing aids were for hearing out various different musical elements, and participants most often rated their hearing aids as very helpful for recorded music, and also for live music. So you can see there between 24 to 32% saying very helpful for picking out these different musical elements, though there were some differences by hearing loss level. So those with severe and profound hearing loss were less likely to report hearing aids as useful for hearing the lyrics and picking out the instruments. And when it came to live music settings, actually, there was an association between more severe levels of hearing impairment and reports of hearing aids being less helpful for hearing the melody, the singer, the lyrics, and picking out individual instruments. If we look at the qualitative data from the national survey, the 3 largest themes were that hearing aids were generally helpful. They helped people to access music and they were aware of more of the sounds, or that they were useful for hearing out specific musical elements. So there's a good tally there with the quantitative findings. And perhaps the third most frequent response was that the music programme was helpful, and that it added to enjoyment, both of listening in recorded settings and actually participating in rehearsals and or concerts. We also asked about difficulties. We asked about, and these were based on prior research, so we asked about the experience of distortion, too much bass or too much treble, because this is something that came out of our interview study, whether participants were experiencing feedback, sudden changes in loudness, or discomfort from loud sounds. Now, again, overall, this can be read positively in that the modal response in recorded settings for participants was that they never experienced these difficulties for 5 out of the 6 of the difficulties that we presented them with the exception of distortion, where the modal response was sometimes. And actually we can see the same pattern in the live music setting as well, where the modal response was never except for distortion. So distortion being experienced very frequently, and actually there was an association there with those with a higher level of impairment were more likely to experience distortion. So there are some positives there. However, although the modal response for the helpfulness of hearing aids in recorded and live settings was 8, and you can see this from the graph up here in the top right-hand corner, the average was 6.5 in a recorded setting and 6 in a live setting, so 6 out of 10 for hearing aids. We also found that audiologists were unsure as to the benefit that hearing aids were bringing for music listening. And we can see in the bottom right graph that of our 93 audiologists that we asked whether hearing aids were useful, you can see that most of them are, sort of 2/3 of them are saying, well, sometimes they are and sometimes they are not. We also found that there were 453 mentions in the written responses in the national survey of people removing their hearing aids for music. So some positives, but clearly some challenges. So what are the difficulties that are experienced? Well, the most commonly reported difficulties are grouped here into those relating to the hearing aid technology, the environment, music, and then also reports of self and others. And as I said, I'm going to draw here on the large scale thematic analysis. So the largest subtheme was hearing aid related difficulties. I've just put the count of some of these themes here on the right hand side. So the most prevalent code was sonic artifacts. This included distortion, feedback, and other phantom sounds. And there were 313 mentions in the written responses about distortion. And this was particularly at the high frequencies and in live contexts. Participants reported that music sounded unnatural and artificial using hearing aids, again, especially at the higher frequencies. And there were frequent problems with pitch perception and distortion. Participants very frequently reported experiencing too much treble, and they often described the sound as tinny, harsh, shrill, or scratchy, and also reported general poor sound quality. And again, some colourful words in the description, such as burbling, crackling, hissing, rattling, and warbling. Whether listening or performing, the whistling sounds actually were a source of frustration, which negatively impacted on the enjoyment of music. There were difficulties around loudness and dynamics. So this included music suddenly sounding too loud, sometimes painfully so, especially in live contexts, or music sounding too quiet, or the hearing aids not being able to cope with sudden changes in volume. And the difficulties related often to hearing aids making the adjustments automatically due to the noise reduction settings or feedback limiters without the ability to control them. So, for example, the limiter suddenly cutting music out at a high level when listening to a concert, or struggling to find a good volume level even when users had a volume control. I'm just including some quotations here relating to harshness and distortion, poor sound quality, and difficulties with dynamics. A second key area of difficulties included responses about the music itself, given the sort of high overall usage, and also helpfulness reported. It's likely that these responses also relate to experiences whilst using hearing aids. The biggest subtheme was frequency or spectral related difficulties, which included music sounding out of tune, or hearing different pitches in each ear, or not being able to hear harmonies or chord progressions. It also included difficulties picking out particular instruments, particularly when they were in the same frequency range or when the music was complex, such as classical music. Participants often said that the music sounded like a wall of sound. It was a bit of a mush. There were difficulties in with loudness in live contexts in particular. So that was another one where the coding was really prevalent. There were difficulties hearing lyrics, and that was both with unfamiliar music as well as familiar music, and this often reduced enjoyment, and sometimes actually led to people reporting that they were listening overall less because they were unable to hear out the lyrics. And then there were also examples of music sounding unnatural or wrong. So just sort of descriptions of music sounding strange or unnatural. And here again, I've just pulled out some quotations. So problems with pitch perception, source separation, lyrics, and then music sounding inaccurate. A third key area was environmental related difficulties. So the largest theme here was about second amplification, and with sort of related difficulties around source signals, which included experiences of hearing aids amplifying music that was already amplified in live contexts, poor mixes, or bad quality sound systems causing dissonance and resonance. Some people reported that these difficulties actually stopped them attending live events altogether. Participants also talked about difficulties with background noise as well. So that might be noisy crowds, or people talking, or rustling sweet wrappers, and sometimes saying that this sort of background noise can be louder than the music at the music gigs. The noise of traffic whilst listening to music in the car was also reported as a challenge. And often these environmental difficulties meant that people were more likely to go to certain venues than others, as they experienced the acoustics in different ways. And here's some illustrative quotations. So not wearing hearing aids because it's already so loud. The background noise making it hard to distinguish the actual music. And then issues in the car. So these are sort of indicative of the sort of environmental related problems that hearing aid users were reporting. And as a result of these difficulties, actually, there were quite a lot of reports of kind of negative affective states as a result. So it might be that the difficulties were causing people to feel frustrated, in some cases, particularly hearing aids in live context. People reported feeling quite tired and exhausted by using their hearing aids in those contexts. And there were general comments about sort of the loss of music and the loss of enjoyment of music as causing sort of sadness and sorrow because music didn't sound like it used to, or because they're disengaged from musical activities. Other negative effect comes from not the music itself, but actually the audiologists. Now there is a sort of there is a positive, lots of positive reports of audiologists as well, but there are some reports of audiologists lacking the knowledge to deal with music in clinic, or they were too time pressured to try to resolve the music related issues. and several were frustrated that there are never any music tests within clinic. It's always focused on speech. And again, you've got some examples here. About those negative affective states and a reduction in enjoyment. Challenges of when an audiologist doesn't seem interested in or able to help. Now, just a few words on the difficulties for musicians. The most prevalent issues here, in addition to those that I've spoken about, are about hearing oneself in performance settings, about hearing others, thinking about how they blend, how their tone blends, or the dynamics and the way they're fitting with others within a performance, and then actually stigma as well within the musical environments. One of our interview participants told us that it had taken them 10 years between finding out that they had a hearing loss and being willing to get hearing aids and to play in the orchestra. And this was a survey participant here saying, you know, I went to extraordinary efforts to make my hearing loss a secret. But I should add that the national survey was focused on listening, so we do have some insights about performance. But as I'm going to say later on in the talk, I think this is an area for development, focusing specifically on the problems for performing musicians. So, how do these findings relate to what we already know? Well, we know about problems with pitch perception and source separation from existing literature. We also know that those with more severe levels of hearing impairment experience greater difficulties, as has been shown in some of the recent work on musical scene analysis at Oldenburg. We also know from prior work that there are issues with poor sound quality and distortion. So, you know, nearly 10 years ago, Sarah Madsen and Brian Moore finding that over 50% of hearing aid users, in a survey, were experiencing distortion at least sometimes. And we know that sound work by Weisberg and colleagues has shown that sound quality is an issue for listeners and musicians. However, this is arguably the first really large-scale evidence of these issues. It's also highlighted how important the issue of being able to hear lyrics is. Now, actually, some of my prior work on preferences and listening behaviour showed that many people consider this to be one of the most important elements in their music listening. And this national survey research has actually really demonstrated this and highlighted that when people are not able to listen to the lyrics, that they do actually start to disengage. Well, some people start to disengage. We also found examples of people, particularly those with sort of severe hearing loss, saying, well, I just cannot make out any of the lyrics, so I've started to listen to instrumental music. So there are some ways in which they have adapted their music listening behaviour because they can't hear the lyrics, but it's an important issue for people. The issue with dynamics and loudness is a crucial area for development. So there's mixed evidence from experiments that have tested sort of different compression strategies on music preference ratings. However, the sort of participant numbers are tend to be quite small, and the musical stimuli are limited, so it restricts the conclusions that can be drawn. But this is a really big frustration for people, even those who have got the ability to control volume on their hearing aids or through a phone app. So it just shows that some technological innovation is needed here. How can we improve the sound quality, reduce the distortion? How can we develop strategies that better deal with the dynamics of music? So that's sort of talking about what we found in the Hearing Aids to Music project. On the difficulties side, I want to now talk very positively about the large-scale evidence we have of strategies that have worked, and I think this is a a really key contribution of the project overall. Again, these can be roughly grouped into the technology, music-related, reports of self and others, and then also strategies that the audiologist told us about in relation to music, hearing aid use for music. With respect to the technology, many participants were using their hearing aids, and as I said at the outset, were finding them helpful, though many mentioned that they had tried new models to improve their experiences over time. And there was a small subgroup who emphasised that their older analogue aids were better for music than their newer digital aids. And that's something that has been Robert Fulford at the Royal Northern was doing some research and found that musicians were reflecting on the fact that they preferred their older aids. So there was a small subgroup that felt that. However, overall, the most common response was to remove hearing aids altogether. And this was more likely in live contexts and more likely if people had a mild hearing loss overall. In live settings, there were many reports of switching hearing aids for earplugs, using hearing protection to avoid further damage, and quite a few accounts noting that they wish they'd used hearing protection previously, so regret having to use hearing aids now because they didn't use the hearing protection in those live gigs when they were younger. When participants were listening to recorded music, many indicated that they would remove their hearing aids and use headphones, and this was reported to improve the clarity, sound quality and frequency balance. Though at the same time, a common complaint when using headphones was that they would experience feedback. When wearing hearing aids, a common strategy was using a music program. But the outcomes were quite mixed. So here I'm reporting it as a strategy, and actually there was some very positive experience. People reporting that the music program helped them to distinguish instruments more easily, or provided a subtle improvement on their speech program. And this was particularly the case when the audiologist had done additional adjustments. So for example, changes to compression or gain adjustments, or disabling the automatic functions for speech. And actually there was a sense in the written responses that the outcomes had been particularly successful where there'd been that additional adjustments. Conversely, there were examples where the music program had not been as effective, or that people couldn't tell the difference between the music program and the speech program. Positively, a key strategy was using volume control to manage the difficulties. So I've just said in relation to the live music context and the difficulties with dynamics that there were still some difficulties, but I just want to say that absolutely, that having the more volume control, the better, whether that's applying it on the hearing aids, also having a mute function on both hearing aids, and also having the control on the app where possible was really highly valued. And those hearing aid users who didn't have a volume control expressed frustration about this. Another strategy that was used was the use of assistive listening devices. So this included T-hooks, Bluetooth streaming, remote microphones and controllers, and phone applications. And so quite a wide variety were mentioned. But in particular, participants reported that Bluetooth streaming had improved their music listening at home. So here's just a few examples of these types. So removing the hearing aids for music, using a music program, and using a smart app. So giving control is definitely improving the experiences. Okay, with regards to music related strategies, the most commonly reported response was avoiding live music and a related theme, loud music. So many were reporting that live context just sounded like noise and was really distorted, that the experience was no longer enjoyable and actually unpleasant. Several reported that their hyperacusis actually made these contexts extremely difficult. When thinking about engaging with music, familiarity was a key consideration, and a common strategy to improve experiences was to select to listen to familiar music, or attend a concert of familiar music. It's sort of, many stress that it's factors sort of not being able to hear out the elements or poor sound quality that were negatively affecting their experience. So actually the memory of the music, of the instruments, of the lyrics and so on are helpful here to improve their experience. It's almost relying on the memory of the music to fill in the gaps. Other themes here were selecting instrumentation, or selecting musical features as strategies for improving experience. So, you know, avoiding instruments in the higher registers was reported a few times by the participants, and actively listening to instruments in a lower register. And one performer said that they, as their hearing loss got worse, they actually changed their instrument. I mean, that's quite an extreme example, but they actually were a violinist, and then they changed to play the viola, and then they actually ended up moving to the double bass when their hearing loss got worse. Okay, so here's some sort of music related ones. Avoiding live music. Relying on listening to music from before or familiar music. Or actually changing preferences. So I can't hear the lyrics in music, although I want to, so I'm going to listen to instrumental music, or you know, I've changed the sorts of music that I'm listening to stuff that I can enjoy more. Perseverance was really key here, and it, you know, with this was something that a sort of strong sense that we got from the interview study, was that those that were willing to keep going, to keep listening, to try different strategies, to try different technologies, were those who were more likely to report better outcomes. And I think, you know, we found in the interview study that some participants were very open-minded to trying new technologies, and some were much more close-minded. And I think there has to be a certain amount of trial and error, particularly when the outcomes are more positive, when there is a chance for multiple follow-ups with the audiologist. And there were positively lots of comments about audiologists being helpful or interested. So while there were comments about audiologists not having the knowledge, not seeming interested, on the flip side, there were plenty of examples of the audiologists being helpful or interested. We also asked the audiologists, so in the second study, the audiology survey, we asked audiologists about how they improve music for hearing aid users, and these were this was a sort of quantitative representation of the written responses in that survey. The audiologists seemed aware of the issues and the limitations, and they were able to report on what they did to help. The most common was disabling the automatic functions for speech, with 42 of the 53 audiologists saying that they did this when they were trying to address musical needs. Changes to compression were frequently cited, though answers were rather generalised, such as change compression type or change compression ratios. So there wasn't very much specific information about the changes being made. One recurring theme, though, was to reduce the compression and set the hearing aids linearly. There were also comments about changes to gain. Some noted an increase in gain at high frequencies. Others reported increasing the gain at low or mid frequencies. So there was some discrepancies between the suggestions about where the gain should be applied. And again, there was a lack of specificity as to the degree of change or how these were applied across the different frequencies. Here are some examples of the strategies that the audiologists were using relating to sort of the functions for speech, directional microphones, compression strategies, and so on. Now, positively, we used these strategies from the listeners and the audiologists to develop some resources. So we developed a leaflet for patients, talking about things that might help, such as using assistive listening devices or listening to familiar music to start off with, or music that's less complex and building it up. We also developed some practitioner leaflets as well. Now, some of that was based around counselling and sort of history taking. So encouraging audiologists to take a history of what, when, where and how the hearing aid user listens to and performs music, what problems are experienced, and how any hearing loss for musicians, how any hearing loss profile might fit with the instrument played. And then also fitting guidance as well, about keeping an open fitting if possible, giving a volume control, verifying with real ear measurements, and implementing a music program. Now, we've had very good positive feedback on these resources. We did this, as I say, we did a resource evaluation study, and there's a write-up of that in the BAA magazine last year, and that's available on our website if you're interested. For the patients, we had some positive feedback about strategies that they tried out, particularly sort of different types of sort of listening practice. But they did point out that a lot of the people that came forward to take part in the resource evaluation study were also musicians, and they did point out that they were really keen to have some musician-specific guidance rather than just something that talks about music listening generally. For the practitioners, they reported actually having used these resources an increase in an awareness of the issues and an increase in confidence in providing advice and fitting hearing aids for music. So we were really pleased because we'd spent some time preparing these, and were hoping that we would be able to distribute them and that they would have a positive impact. And it did very much appear that this was the case. We've got audiologists saying that it's changed how they operate from reading through. If someone comes in with a problem with a music issue, then they'll read through and think, have I looked at this? Have I looked at this? And try and address that problem through use of the resource. In the second quote, we have an audiologist saying, you know, the quick reference, so the quick guide that we developed is really helpful. So if I've only got 5 minutes, then I can just read through and check that I've sort of addressed the main points that I need to. And then also some comments about patients feeling empowered when they have leaflets, that they can go away, that they can read about what some of the issues are for themselves. Okay, so I've talked about some difficulties, I've talked about some strategies. How do we address these challenges going forward? Well, first of all, I continue with the Hearing Aids for Music work. I continue to share the resources and to give talks to NHS and other audiology departments to raise awareness and give them an opportunity to ask any questions that they might have. I these resources are available on the Hearing Aids for Music website, and they are online resources. So I'm working to improve them at the moment, to include latest research evidence, and that's just going to be an ongoing endeavour to just keep improving them with different versions and sort of the latest technological advice. I recently got some money to translate the resources into different languages. So different languages that are commonly spoken in the UK and around the world, to enable greater access to this sort of advice about music listening with hearing aids. And I also want to engage these communities to raise awareness of the resources and of the project in general. So some examples: Polish, Spanish, Portuguese, Urdu, Punjabi. I just sort of, wanted to make sure that the leaflets were accessible to a wide range of people. The other thing that I'm going to focus on is looking at establishing some instrument-specific difficulties and strategies, because a lot of the people that I've worked with over the last few years have said, well, yes, this is great. We've got some advice about music listening, but actually we're performers and we really would like some tailored guidance. Now, there are some strategies. There's a sort of there's a book that is by the Association of Adult Musicians with a Hearing Loss. It's in its second edition, that's focused on performers and strategies. So this, could be potentially a collaboration with them as well. But we need some large-scale evidence of what the issues are, so we can develop that guidance. I'm part of a project, as Kai said, the Cadenza project, that's exploring how we can harness the power of machine learning to improve music processing on hearing aids. So the project has two different strands. So running the challenges to improve the processing of music using openly available musical materials and open source hearing aid and loss models. The second is to carry out perceptual testing with people with hearing loss to understand what they want from music and to develop better methods for evaluating audio quality. At this stage, we have carried out the first challenge and round of sensory and listener panels, and the second challenge is underway. In the first challenge, we devised two tasks to encourage the machine learning community to start engaging with the issue of hearing loss. So we know that audio signal processing is a fast-moving area of research, but typically fails to consider those with hearing loss or difference. So the first one was a sort of remixing, demixing task, where there already exists a community to sort of raise profile and to get entrants working on this. And in the second, we chose an everyday scenario that hearing aid users told us was problematic. So listening in the car. For the second challenge, which is in progress at the moment, we had quite a few of our participants tell us that that they would prefer to be working with classical music and responding to classical music in these sort of listening scenarios. And so we've got a task which is focusing on rebalancing classical music. And the second task is focusing on lyrics intelligibility. So what we're trying to do is to use some of these key difficulties that the hearing aid users are telling us that they're having and feed them into specific tasks to have a look at how we can improve the signal processing. And we're hoping to do something around loudness and dynamics for the third challenge. That's not been fully decided on yet. Now, an important part of this is the sensory and listener panel work. So what we've been doing alongside is actually trying to understand what hearing aid users want from music and what for them determines what audio music quality is. So we've carried out a series of sensory panels. I've done this with my colleague Scott Bannister, colleagues Scott Bannister, Jennifer Firth, Bill Whitmer, Michael Ackroyd, Trevor Cox, and so on. We've devised a series of sort of sensory panel and listener panels, and what we wanted to do was actually understand what is what the key perceptual attributes are. So we asked participants to engage in an individual elicitation task online, and asked them to sort of tell us what to describe the music as they heard it. And then we got them here to the University of Leeds in a group. There were 12 forming part of the sensory panel, and asked them to respond to those the same musical stimuli, and asked them to define these important characteristics. And over a series of focus groups, we got them to come to a consensus on what were, for them, the key attributes. This included clarity, distortion, harshness, frequency balance, and then we had an overall definition of audio quality as well. And the reason that we've done this is that we then are using those attributes to rate the listener panel. Then will rate the challenge entrance systems, so that have been employed to improve the audio quality. The listener panel will rate according to these specific attributes. Now, with the work which is describing the work of the sensory panel is out already in Frontiers in Psychology, and we're working on the analysis of the first challenge. But what is particularly interesting and sort of a broad level finding at this point is that we know that clarity and frequency balance are an increase in those is predicting an increase in perceived overall audio quality for these hearing impaired listeners. And we know that an increase in distortion and harshness is predicting lower overall audio quality ratings. So it's interesting then, if we think back to those main problems that I've outlined there in terms of the technology related problems to do with too much treble, things being tinny and harsh, and very prevalent experience of distortion, we can see here that these are the central attributes to be focusing on. I'm also involved in a project at UCL, which is looking to characterise the neural code for music and how this is impacted by hearing loss and hearing aids. So we know that distortion is a key problem for hearing impaired listeners. In an ideal world, a hearing aid would improve perception by correcting the distortions in the brain's internal representation of music, which is caused by the hearing loss. So it's a project to sort of understand better how music is represented in the neural activity. There's a couple of different methods of doing this, a sort of combination of large-scale electrophysiology to explore how music is processed by the auditory system. That's using an established animal model of human hearing. And then computational methods. There's a variety of different analytical methods being used. Now, we've actually used the stimuli from the first cadenza challenge, so that we've got the neural recordings, as well as the musical stimuli, as well as actually the listener perceptual ratings of the quality attributes. So we're quite excited about what we're potentially going to find out here. And my colleagues Nick Lessiker and Pauline Marrowwood are currently doing the analysis for that, and I'm hoping that we can get them here to talk about that work in one of these seminars to give us an update. I'm also working on a project with Sam Kuth, which is looking at how we might develop interventions for audiologists for providing, for addressing musical needs in clinic. So I've undertaken a study to look at how audiologists are currently providing care to musicians and to identify barriers and facilitators for providing that care. So we've undertaken a survey study with a clinician, Mark Smith, who was based at Imperial, to have a look at their practice. And we've also done an interview study as well. And we're just focusing at the moment on the results around the types of service provision, patient history, audiological assessment, rehabilitation, and so on. So this is a watch this space, and we'll be talking about this study in the next seminar. And then last but certainly not least is the Oral Diversity Project as a linked project that I've been involved in. Now, this project aims to explore the consequences of hearing differences in different disciplinary areas. I think it's done more than explore the consequences of. I think it's positively disrupted practice across a number of disciplines already. And I think something that's really important as sort of one of my final thoughts today to say is that although what I've been talking about is broad patterns or trends, so what are the key difficulties, music related difficulties, what are the key difficulties with the technology, what are the strategies that people are using, and then sort of talking across to come up with potential solutions. Actually, the data does also highlight just how individual everybody's journey is when they have hearing loss and they're trying to grapple with that and their musical engagement. Now, this was really shown in the in-depth interviews and in a chapter in the Oral Diversity book, which was edited by John Drever and Andrew Hugill, who lead the network. I talk about different case studies of those who've got a mild loss, different case studies of those who've got a moderate, and it really just shows just how important it is to take those individual sort of musical training or engagement profiles into account, and then really think about what that individual needs in the future, whether that's listening or performance. And actually this ties in with what the audiologist was saying as well. Whilst overall we're trying to find strategies that work so we can generalize, so that we can say, yes, okay, if you take this particular approach, then it's probably likely to help your patient. But at the same time, something that came through strongly from the audiologist that responded to our surveys and spoke to us in person was that each individual needs that person-centered approach, that actually we need to know about their history, we need to know about their musical training and their instruments, and we need to take them on a case-by-case basis. So, and I think that's a really important sort of point to bring out, that it's always important to look at the individual in their own context. And I'm very grateful to Andrew Hugill and John Drever and Bill Davies and others on the network for connecting me through this network with various different hearing healthcare practitioners working in ENT and in audiology departments around the country. That's been fantastic to be involved in. And next week, there is the Laura Doctoral Network Sandpit. They've just been, Bill and John have just been awarded money from Lever Hume for a doctoral centre to explore hearing difference across these different disciplinary areas. So much more to come from the Oral Diversity Project over the coming years. Okay, I've talked for quite a long time, so I'm just going to summarise by saying that people are really highly engaged with music. This really does need to be part of audiological practice and also on manufacturers' R&D agenda. We know that hearing aids are helpful, but they do need improving, and there are various different projects that we're undertaking in order to do so, and there are specific key difficulties that this large-scale evidence shows that that provide that focus, provide that future focus. And I think what the projects that I've described to you that are the ongoing projects have really demonstrated is that we do need this interdisciplinary and intersectoral working for tackling the challenges. Okay, thanks for listening.
Thank you so much, Alinka, for this very rich account. That was really very fascinating. I think we can take a few minutes for questions before we go on with Christoph, unless Christoph needs to leave in 10 minutes. Not sure about that. No, I think he's fine with us taking some questions. Please type in your questions to the chat if you like, or just come on stage and directly pose your question, however you like. Are there any direct questions to Alinka's talk? So if nobody wants to start, then let me.
I have a question.
Yeah, there's
yes.
one.
About the survey.
Christoph.
Yeah, so sorry, thanks for the comprehensive overview. Just for the survey, so you have only NHS patient. So do they have one type of hearing aid, or it's more a broader range of hearing aids?
Yeah, good question. So it's not only NHS participants, though they did make up a big part of the survey respondents. We did ask about the hearing aids that people used, and because there were a large number of NHS participants, there was around probably, I think it's 70% were Phonak and Oticon because hearing aids, and that's because there's a large tender there for the NHS. So it was around 90% of people were from the UK, and then there were 10% of people who were international.
And then there was a question by Jonathan Tang.
Hi, thanks. Thank you, Alinka, for that presentation. I have two questions. So one is pertaining to the sample. Could you share a little bit about the diversity of that sample in terms like of whatever, if you have that data? And then the second one is related to, did you also collect data related to like well-being and the lack of, or the being able to not listen to music had an impact on, I don't know, well-being or some sort of measure, which then shows why, which could lend evidence to like why audiologists should ask this instead of just focusing on, you know, speech or whatever. So I wonder if you have comments to those two questions. Thanks.
Thanks very much. So in terms of the diversity of the sample for this big national survey, so the data that we collected was around age and gender and educational background and then music background. So we didn't collect any data on sexuality or ethnicity. In terms of gender, it was 49% male, 59%. So they're really completely down the line, which is unusual for for studies. In terms of age, there was a mean age of 60. We did have I think quite a mixture of ages, and I think that was due to the online nature of the survey. Interestingly, you would predict perhaps that those in the severe and profound category would be more likely to be older, but that was actually our youngest category. And I wonder whether that's perhaps because of the online nature of the survey. So yeah, there's just some characteristics of the sample. In response to the well-being measure, I think there's a huge amount of literature in music psychology which is attesting to the functions of music listening in everyday life, and then also the benefits of actually active participation in music making. And so I guess a project would be to bring the latest research in that area together to make a compelling case. And it's a great idea. So thank you for that.
There are two interesting questions in the chat. So one from Vincent Schönfelder regarding feedback. So you mentioned people experiencing feedback when using headphones to listen to music. Would that be when they kept wearing the hearing aids or after removing them?
Yeah, that's a good point. I actually realized what I'd said when I said it at that point in the slide. This is when they get feedback if they are wearing hearing aids and they yeah, so yes, apologies. I did realize that when I said that at that point in the slide. So I think the main point here is that there's a lot of people feel that the sound quality is so much improved if they are listening through headphones, even if they are missing some of the detail.
And then there's another question by Susan asking, did you collect data regarding the length of time that your participants have used amplification? Was there a difference between those who have used hearing aids for a longer time versus those who are new to amplification? I was also actually really interested by that question. So, so technologically, how far are we looking into the past in this survey? Because obviously the hearing aids that come out today are different from those that people might have been using for some time.
Yeah, that's a really important question. And I think I put the detail on my slide. 80% had been using them for 3 years or longer. We didn't actually ask how long have you been using hearing aids for, so we don't actually have the data on specifically on that, unfortunately. And
Okay,
the second part of your question about, is there a difference there? So I don't think we can do a specific, hang on a sec, wait a sec, I might be able to just answer this just quite quickly now. But yeah, it's certainly an important point and something to be aware of about how long they've been wearing them for.
So Kirsten is asking, do they have experience of listening to music without hearing impairment versus being hearing impaired by birth?
Yeah, so that's another important analysis that we could potentially do in the data, is to look at whether they've whether they've been deaf from birth. We had quite small numbers, I think overall, of those who were deaf from birth versus those who have had an age-related hearing loss.
All right, I think in the interest of time, because we're slowly approaching the 17-hour Central European time limit, at least with Christoph's talk ahead of us, we need to close this discussion of Alinka's talk. So thank you very much, Alinka, for the discussion and the great talk. And now we go on with Christoph Wissnampler. And perhaps, Christoph, do you want to start sharing your screen already? Yes, wonderful.
Yes.
So Christoph is a research engineer at Sonova, and he has basically a professional career in music, but also in audiology. And at some point, he switched over to audiology, and even more as a hobby, he works as a lecturer in statistics and data science. So multiple things going on. And it was a very fortunate circumstance that we have the chance to also work together in the last year. And now Christoph is presenting parts of that collaboration. Christoph, the floor is yours.
Yes, thank you very much. As Alinka mentioned, music might play an important role, but hearing aids are still designed to improve intelligibility in various listening environments. So some requirements for signal processing are making speech audible and improving the signal-to-noise ratio. And here there is a clear definition of the target signal, so it's speech. And this focus might not always provide optimal experience when listening at music, because listening intentions or acoustical properties and the variability of the target signals are very different from a listening situation with speech. So it motivates the need to use a specific music listening program. So when activated, music program applies changes on the frequency response, dynamic range compression parameters, and also on adaptive features, which are mainly designed to improve the signal-to-noise ratio. And this aspect is not systematically relevant for a music signal. So the changes are evaluated with perceptual tasks, like absolute or relative rating or paired comparisons. And literature show a lot of examples where music is included as a music genre is included as explanatory variable, with the assumptions that music genre might interact with the different tested conditions. And so the sampling process needed to select the test signals is critical, and there are some trade-offs. So on one hand, the sample need to be short enough so that you can make direct comparisons between the tested condition, but the sample must also be at the same time representative of the genre if we want to generalize our findings. So the selected sample used for the evaluation is defined by its genre, but we don't know how well the genre is defined by the selected sample. And generalizing interactions between test conditions and music genre is only possible if we have an idea about the variability between and within the genres. So we built a database from 2 reference studies to explore the between and within genre variability using audio descriptors. So the level of each piece or song was normalized on loudness, and 3 samples were then randomly selected. The samples were analyzed unprocessed and also after amplification with fast and slow acting dynamic range compression. Amplification variability was then described to show how genre is interacting with the different test conditions. So we had collected some audio descriptors that were linked to variations in energy and spectrum and also noisiness. They were obtained from the left and right channel separately and then averaged. And here are some examples about the data collection. So the idea was to collect descriptors with a sliding window over the sample and then compute statistical moments to describe the distributions. So here you have the distribution of the RMS for the unaided condition on the x-axis and on the aided condition on the y-axis. And you see amplification increases the location of the distribution, but it also reduces the dispersion of the RMS. So it's a nice illustration of dynamic range compression. On the frequency domain, so we need to know that amplification has an effect on spectral information, and it directly depends on the hearing aid frequency response. So here the amplification was defined for N4 audiogram, so with slightly more gain in higher frequencies. And here's the mean spectral centroid, which is basically a center of gravity of a spectrum, is increased with amplification. But this change from unaided to aided is not systematic. So the effect of amplification is reduced when the unaided spectral centroid increases. And this leads to a smaller dispersion of central spectroids, meaning that there is less spectral variation when amplification is applied. So the distribution by genre here is shown for the unaided condition. So you have the dynamic range with RMS standard deviation and spectral information with the mean spectral centroid. And this is in line with reference data, so suggesting that more classical genres, like here, have larger dynamic ranges, and more modern genres have more energy and higher frequencies and a flatter spectrum. So here on the right part. There were a lot of partial correlations between the features, like between the HearMus standard deviation and the peak to average ratio. It's kind of a crest factor, or between the spectral centroid and the harmonic to percussive ratio. And this motivates the use of a dimension reduction approach with a principal component analysis to understand the main differences between the genres in the unprocessed condition to start. So here are the mean values and individual observations on the left per genre. They are projected on the two first dimensions with a 95% confidence ellipse. And on the right, you have the variables with high contribution to these dimensions. So the first dimension is mainly loaded with a harmonic to percussive ratio and spectral information. And the second dimension, so this one, encompass some variability information about variability within a genre. So if we look on the left, we see that classical music genres are grouped together on the left on the first dimension, which is related to a low spectral flatness or high harmonic to percussive ratio. And modern genres tend to be on the right side of the first dimension due to more percussive sounds. Furthermore, they show more variability on the second dimension, like rap is here or higher, so it's a alternance between more rhythmic and song lyrics. And on the metal side, you are more on the lower range of the second dimension, where you have more constant percussive stream. What is also interesting is ellipses that show a considerable overlap between the genres, and especially between the orchestra and pop genre, which are often used in the literature. In general, so differences between genre means are marked. However, within genre, variability is quite high, so that a single random sample might not be representative of its own genre only. Another interesting aspect is within piece variability. So here, these samples shown by a point are collected using a sliding window with a step size of 1 second over an entire piece. And audio descriptors are projected on the PCI dimensions for 2 orchestral pieces on the left and 2 pop songs on the right. And the distribution illustrates the fact that so within piece variability is not systematic, but when it occurs, then one sample cannot represent an entire piece, and furthermore, the entire genre. We wanted also to show the effect of amplification on dynamic range and spectral shape. So here we start with the unprocessed bivariate distribution. So on the x-axis, you have the standard deviation of the HearMus, and on the y-axis, you have the spectral centroid median. And for each sample, we compute the difference between the descriptors from the aided N4-based amplified signal and an amplified signal with 0 dB insertion gain. And here the amplification effect is averaged by music genre. So the median effect corresponds to 1 arrow. And it's shown for fast and slow dynamic range compression. And here we have a nice illustration that fast-acting compression reduces the dynamic range compared to slow-acting range compression. So here the arrows go towards the left with fast-acting dynamic range compression. And the magnitude of changes in spectral centroids interact with the music genre. So here it's more quantitative interaction. So if the unaided signal has already a high spectral centroid, then the amplification will not have so much effect than if you have a low spectral centroid unaided, like with the piano, so where you have a huge change in spectral centroid. And so here it's a nice way to explore the interaction between amplification and music genre. But here you have only a median effect. So there is also a variability of this effect. And here we see So the variability of amplification with fast and slow dynamic range compression. And we see there is a clear overlap between some genres. And so the effect of amplification on these descriptors is more pronounced for classical genres than for modern ones. So our analysis suggests that music shows large acoustical variability within a song and piece, and even within a genre. And this is a good news. So it makes music not so boring and always nice surprises. But the boundaries between them is not clearly defined, acoustically speaking. It supports also the need to increase the number of tested samples and consider them as a random effect to reflect our findings. So effect of amplification is not homogeneous and will directly depend on the selected sample. And in general, more information should be provided during the sampling procedure to ensure that acoustic variability found in everyday life is also represented in the evaluation. And this would help to generalize the differences found when we compare hearing aid settings. And so here is the presentation is taken from a publication, so it's more information if you are interested in. And I thought it's maybe interesting also to show you a direct application, how you can treat this stimuli in a statistical analysis, because there are plenty of approaches to do it. And this is just to scratch the surface of how to define a random effect. And so the data are taken from a true experiment. It's a subset of the experiment where I just took two aided conditions. I can make it slightly larger. So there are two conditions. It's fast and slow acting dynamic range compression. Basically, it's the same conditions that were used for the presentation. I will just focus on a single genre, pop music, where basically there was a subset of 5 songs, and from each song, there were three excerpts that were taken from each song. So there are 15 stimuli. They were tested with 33 hearing impaired listeners with a moderate hearing loss. And it was an unbalanced design, so each listener had to rate 10 stimuli to make it possible, because I had a lot of things to do. And the outcome is a rated sound quality on a 10-point visual analog scale, where higher rating stand for better quality. And here, this is a distribution from the raw results. And this might be misleading because here, some points are coming from the same subject and some points are coming from the same stimuli, and everything is crossed. It gives a good trend to show here with slow dynamic range compression. There is a higher sound quality, but still it will not be really accurate. So there are two ways to make a better picture, maybe. It's first to average within each subject all the data points. So we have 1 point for each subject for the fast and slow dynamic range compression. And basically we look at the slope of the change. So it's positive. So it means for a majority of listeners, there was a benefit using slow acting dynamic range compression. But the same thing can be done also over stimuli. So if we look here, so for each point, you have the average for each stimuli. And here we see also a similar trend. So there is a higher rating with a slow dynamic range compression. But if we look closer, we see that basically samples with a low rating with a fast dynamic range compression get more benefit with a slow dynamic range compression. That stimuli that have already a high rating with a fast dynamic range compression. So it seems there's the effect of dynamic range compression is not systematic within all the samples. Some samples have more benefit from dynamic range compression than others. Okay, so that's just the data summary. For the statistical model, we'll use some linear mixed effect models because they're allowed to include multiple sources of random effects and also to specify more complex structures. So the dependent variable is a rating. There is only one fixed effect to keep it simple. So it's just the effect of dynamic range compression. It's from fast to slow. And the formulation, so this is a standard formulation. You have the outcome, which is explained. This is a tilde by a condition, which is a dynamic range compression. Here we specify a random structure, random effect structure, and this is implicit. There are always some residuals with a difference between the model and the observations. And the one thing that is sometimes seen, and what we should not do, is basically making the average by subject and analyzing the average by subject. So basically, here this is the random effect with 1 over subject. So it says basically we allow the intercept to vary by subject. So some subjects have better rating, some subjects have lower ratings. And it's so a random intercept or varying intercept. So it means here this random effect allows the subject to vary around the intercept. So it's a regression. So the intercept is the average for the fast dynamic range compression, and the slope, the second line, is a change from fast to slow. So here it's we have an intercept, excuse me, from 5.9. So this is the average for fast dynamic range compression, and when we switch to slow dynamic range compression, basically we increase average rating by 1.4. And specifying the random subject or varying subject as random intercept means that we allow the intercept, so 5.9, to vary, and the effect of variation is given by the standard deviation. So there's a rough estimation that you can make to get like 95% confidence interval. So it's maybe not statistically speaking the exact definition, but gives you a good idea. So it's 2 plus minus 2 times the standard deviation. So if we want to have a range of variation of intercept by subject, we take this 5.9, which is my intercept, and make 2 times 1.3. It gives me a range from 3.3 to 8.5. And this is basically what is given here, so 3.3 to 8.5. So here I should have 95% of my observation by subject. Okay, so this is the first approach. We shouldn't do like this because here basically we lose a lot of information. So the information by stimuli, because we do an average by subject. So we shouldn't do it. And then there's the issue of how to interpret this value, because the value is an average. So if I want to predict for new subjects, it's really difficult to know what do I really predict. I predict the average, but I have no idea what is the variability coming from this average. So it's not a good idea to make averages before the analysis. We should always use the full data set where we include the subject as random intercept, but also the stimuli as random intercept, because we repeat measures, we are repeating measurements on the stimuli as well. So this gives us like 2 sources of random or varying intercept. So for the subject it's 1.3, and for the stimuli it's 0.5. So we see that the varying intercept by stimuli is much smaller than by subject, and this is what we see here. So the distribution here around the central tendency is much larger for the subject than for the stimuli, but still the stimuli is an important source of variation that we should include it. So this is a little bit the minimum, the smallest models that we should use for this type of experiment. What we have seen also is that basically when we have low rated fast dynamic range compression, we had much steeper slopes, so a larger effect of dynamic range compression than when we had high rating sound quality. So what we can also allow is a varying slope. So the slope is the effect of dynamic range compression going from fast to slow. And this is a way to formulate it. So we allow the slope, so the effect of dynamic range compression, to vary by stimuli. So with the assumption that some stimuli might have more effect with dynamic range compression than other. And here we have a little bit more variations that is included in the model. So we can still, how can I start? Yeah, we can still look at the varying intercept, which is basically the random intercept. So by subject, so I take my random intercept, and I add 2 times the standard deviation to get the interval of variability of subject, so which is really close to the previous one. I can do the same for the stimuli, so I take my intercept, which is 5.9, and I add 2 times the standard deviation. So it gives me also an interval where I have my varying stimuli. And it's also not so small, so it means there is a real effect of stimuli. Some stimuli are rated lower than others. And now what is important is a random slope. So here is a slope, estimated slope from the model. So it's 1.4, this is average effect, but we allow the slope to vary by stimuli. So some stimuli will have larger effect on the slope than others. And here I have simply to add or subtract 2 times the standard deviation to get a range of varying slope. And here it's really interesting. So it seems that it's always positive. So there's always a positive effect of dynamic range compression, but that for some stimuli, I have an effect of 2.6, which is really large. And other stimuli, I have an effect of 0.2, which is almost no difference. And so this is really an interesting findings that you can also add in your model. What is also interesting is this negative correlation. So it means that when we have higher intercept, the slope tends to be smaller. And it's exactly what we see in this graph. So when I have increasing intercept, basically, so when I have higher values with fast dynamic range compression, basically the slope, the difference between 2 conditions, gets smaller. And this is explicitly written in the, and modeled in my analysis. So here I can learn something new also from this model, not just knowing if there is effect or not of dynamic range compression. And here it's the same what I wanted to show. So I put here all the stimuli, and here it's the average rating for fast compression. And on the y-axis, you have the effect of dynamic range compression. So this is the intercept on the x-axis, and the y-axis is the slope. And you see that for some stimuli, there is almost no effect of dynamic range compression, and for other stimuli, there is a huge effect of dynamic range compression. And what is interesting is also that, so the color shows the piece or the song, that there is no really one song that has a stronger effect, so on dynamic range compression or not. And if I just take a few samples here, I won't find any difference between conditions. And if I take other stimuli, I will find a large effect of compression. So maybe the reality is a mix of everything. And this is why it's important to take it into account in the model. There's another, maybe it's the last one, and after I will be done. It's the idea of we select one genre, we select songs, and within each song we select stimuli. So there is the idea of hierarchy or like a nested model. And this can be also modeled. So we have the piece or the song, which is the first level, and within each piece, then we take some samples to see if the piece itself has an effect. So there are different ways to write it in the model. So it's either you code for the first level piece, and after you say, I want to have a second level of variability, it's a stimuli within piece, or you can code it simply like this, it's equivalent. And here you see, so the standard deviation, so the variability of the intercept by piece. So this is what the variability of piece, and just above is the variability of stimuli within a piece. So here we see we can even break down a little bit to see if some songs have a more positive effect, or if dynamic range compression has a more positive effect on some pieces, regardless of the stimuli, or if it's independent. So you can see you can easily make really complex random structures, and it should be always driven by some knowledge and some and before data collection, because it's not advisable to collect the data and after try to look at what you can find in the data. It's also the difficulty when you have too complex structures that you model won't fit the data, so you won't have a solution. And so that's why it's sometimes better to keep it simple and understandable and interpretable, not having a too large structure. I put, at the end, there are some discussion about random effect structure, how we should use them. There is also a rule for random effect. I learned it's also says 5 levels, so you need to have at least 5 levels in a random effect to treat it as a random effect. It's like subject. If you have less than 5 subjects, it's maybe difficult to generalize beyond your sample. So it has the same idea. Yes, and I hope so you have also a application of all what I have talked till now. And if you have any questions, you are of course welcome.
Thanks, Christoph. There was a wild mix of a hearing aid acoustics and statistics tutorial, but I think many of us will appreciate it. Are there any questions on this wild mix? Yeah, as we just practiced that, we can have questions in the chat or in or you can just raise your hands. So Vincent Schönfelder is asking regarding the first topic, do you have a simple explanation for the observed narrowing of the spectral central distribution as a consequence of hearing aid processing? Yeah, that's a good question.
Yeah, I think the hearing aid has a specific frequency response, and basically by always applying the same frequency response, it's also narrowing. It's a narrowband signal, so you will always have the same color to the output of the hearing aid. So it's you won't have so much variability at the end.
And the follow-up question is, which, if any, of the observations do you believe would generalize to other hearing profiles? That's a good one. Also, I don't think we discussed that in the paper. To which extent our simulations generalize to very different hearing profiles than compared to the ones that we considered.
Yes. So two other hearing profiles. What do you mean with hearing profiles? Maybe there are different interpretation of.
Oh no, I mean you you looked at this N4. That's what I call a hearing profile, the audiogram, right? But if you have I assume when you have a shallower or steeper hearing, and steeper progression of the audiogram, then it's probably the same effect to a stronger or less strong effect. But what about if you have a like mid frequency hearing loss or low frequency hearing loss? Do you think any of the observations will still show in a similar way or in a slightly different way, or is it really only applicable to hearing profiles that
it would be different? Yeah. We try it out because basically if you have increasing hearing loss, you have more compression also. So fitting rational will prescribe more compression. So you will have more effect of dynamic range compression. If you have more milder hearing loss, even with the same profile, same shape of audiogram, you will apply less compression, so the effect will be smaller. And as you say, if you have a more steeper hearing loss, maybe you will have even more pronounced frequency response, so more amplification in high frequency will account more in the output of the hearing aid. So this is also a good point because it shows how complex it is. Here it's only for one hearing loss. We did a simulation. I started with other, but then it's just exploding. because just to interpret, then you have to say if you have a reverse hearing loss or more flat hearing loss, it changes everything. Yes. So except the harmonic to percussive ratio, you know, we use median filtering to separate the percussive signal from the harmonic signal. And it seems on this domain, on this dimension, the hearing aid has low to little effect.
Thank you.
I would have a very open discussion question for Christoph. So based on this acoustic model, how would we go about selecting stimuli for the next data collection session? So how do we actually use it now that we know that acoustic variability is huge?
Yeah, so either we reuse its database and we can compute maybe not on just the 2 first dimensions, but maybe on the 4 first dimension of the PCA, like samples that are more representative of a genre. It's maybe, yeah, it's a compromise because you assume you want to have the most representative pieces of a genre. So you ignore a little bit of variability, or you can say, no, I want to acknowledge this variability and take also extreme, so the closest and the more far away from the mean for every genre to have a wide range of selection. I think both approaches are valid. And I think then there is a pragmatic approach because you cannot test for other people, so you have to make a compromise about the amount of samples. But the good thing is if you increase the amount of sample, you also increase your statistical power. So it's good. And it's cheap. Cheaper than recruiting people.
Okay, at the moment, I don't see any further questions, but we still have a bit of time. So anybody wants to ask questions to Christoph or Alinka or, yeah, Alinka.
Yeah, just got a question, Christoph, about whether you could automate, you could automate the process with many different stimuli and hearing profiles, and is there potential there?
Yeah, I started this, and I think just for sake of clarity, I focus on one profile because then you see there's then an interaction between also hearing profile, so frequency response, amount of dynamic range directly influence so at least the magnitude of the effect. It won't change everything, but. And then it's really difficult to interpret because it's going in all the dimensions.
I was going to say something else, but I think Jonathan's got a question, so I'm going to.
No, go ahead.
No, it was just a comment really more than a question, which is about, we know in music psychology literature that preference for certain styles of music cluster together. Whether that be sort of, rock and heavy metal on one side, or whether it be classical and blues and jazz on this side, like there are dimensions of preferences. And I wonder whether, just thinking about the application down the line, whether, and I noticed actually in some of your graphs that there were clusters, whether there can be some, potentially down the line, some fitting strategies that are based on these kind of clusters of preferences, where you could quickly ascertain from the hearing aid user which is their most listened to the dimension of preferences. It's just a comment really, more than a question.
Yeah, I think those who have a little bit experience with this type of test, it's really interesting when listeners are not so familiar with one genre, music genre. And sometimes they are a little bit like, giving the rating, but they have to go over their own boundaries. So it's like, give my answer, but I don't like anything, especially if it's too classical or too modern, and this is still the mainstream music, kind of mainstream music. Yeah. And I don't know if it has an effect like there's this random intercepts or varying intercept by subject, so people will give higher ratings because also they like it in general.
Yeah,
you know,
yeah.
over the type of testing, it's really difficult to to disentangle both effects. So they give a high rating because I really like it.
Yeah, that's a good point, Christoph. Really good point. Sorry, Jonathan, you were going to come in, and then I think there's another question in the chat as well there.
No, I had kind of the same question because of, I mean, thinking about applications in terms of clustering and because I think this, if I understand it correctly, you use pop music, which is quite wide, and it's depending on what kind of pop music, right? It can be a mix. I mean, nowadays pop music is mixed with different types of genres or of hybrids and things like that. And like I think what Alinka was saying, if there's like, you know, you test for maybe a jazz genre, a pop genre, a rock genre, and then so it could be, that could be a starting point for someone who comes in with, let's say they like jazz music, then the fitting would be with that certain genre to start with, and then the individual differences can then be edited or fine-tuned as the process goes along in terms of fitting. I guess my question is more like jumping off of that, like what would your next step be? I'm curious about what will happen next now that you have this data set in terms of, yeah, what are you gonna do with it? Or what's the next research question, if you have any?
Yeah, I think it can be for us to have a available data set, like if you want to improve something in the hearing aid, maybe to have a quick way to, you know, to generate recordings, maybe for evaluation, or to use objective metrics. So at least we have like a pool of samples, or we can use, like I said, maybe the closest, most representative samples from a genre. But you are right, sometimes genre is not a strictly defined. There are no so strict boundaries. Sometimes it's really, more shadow, and it represents also evolution of music, which is basically just a succession of changes. That's interesting. So I think it's more to have like this large database, maybe to have some automated process for us also to develop different features, or at least to verify them in an early stage without having listening tests, but later using listening tests. Yeah.
Thank you. And I think you have one question in the chat.
Yes. Also, okay, the sliding window was a specific window. No, it was a rectangular window, and the overlap, I think it was 50%. Good. I don't know by heart. It's in the paper. We wrote everything. It's a good motivation to go and download it.
It's a great ad at the very end. Thanks, Christoph. So I think we're coming to a close now. Thank you all very much for participating in this very nice discussion and all for your interest in this topic. Thanks to Alinka and Christoph again for very engaging and inspiring talks. And the good news is we'll have this as a regular thing going on. So we can reconvene in November and see each other again and start addressing other topics that are interesting and relevant in this round. Alinka, do you want to say something for the end?
Yeah, no, just thank you everyone for your time and coming along today, and we hope to see some of you at the next one in November. I'm going to host the recording up on a YouTube channel, and then put that up on the Hearing Aids Music website, where we'll just have a rolling page that contains the recordings and information about forthcoming seminars, and we'll circulate it around all the usual links and mailing lists as well. So yeah, just to say thank you for sharing this first kickoff seminar with us, and hope to see you again.